Hello, everyone. Good afternoon. Our next speaker is Congresswoman Ayanna Pressley. She graciously sent in a video to us in place of attending today due to the confirmation of the first female Black Supreme Court Justice, Ketanji Brown Jackson. We send our love to her and our congratulations to Supreme Court Justice Brown. Congresswoman Pressley, a legislature, a survivor, and the first woman of color to be elected to Congress from the Commonwealth of Massachusetts. Throughout her career, she is fighting closely for those of people that are in pain, driving and informing policy, and working for justice. In Congress, she's been a champion for justice and healing, reproductive justice, justice for immigrants, consumer justice, justice for seniors, justice for workers, justice for survivors, and justice for people who are healing from trauma. She's also a founding member of the Black Maternal Health Caucus, created by Representative Underwood and Adams. She continues to be a fierce advocate for Black maternal health. Please join me in welcoming Congresswoman Ayanna Pressley. Thank you.
Hello, everyone. My name is Ayanna Pressley, and I have the honor of being the Congresswoman representing the Congressional 7th District, a district that is majority parts Boston, Cambridge, all of Somerville, Randolph, Everett, Chelsea, and Milton. A district that is vibrant, diverse, and dynamic, and home to some of our greatest inequities. It's one of the most unequal districts in the country and the most unequal in our congressional delegation. And that is true when it comes to public outcomes as well, which is why I very much appreciate being invited to this virtual table to join all of you today. I want to extend my gratitude to Dr. Amuta Onukaga and the rest of the team for inviting me to join you in this critically important conversation. And I thank you for what you do each and every day. Of course, our country's maternal health care system was in crisis long before COVID-19. But the pandemic has created new challenges for pregnant people, placing them at an even greater risk for serious illness and breakthrough infections, while exacerbating those longstanding health disparities. Black and Indigenous birthing people deserve to be protected, honored, valued. A safe and healthy pregnancy is a fundamental human right. And yet, for far too many people, it has been treated as a privilege. We need to speak candidly and openly about the unjust health risks they face and about the cost those risks pose for expectant parents and the communities that they are a part of. Again, despite being one of the most diverse and vibrant districts in the country, my district is also home to some of the most stark health inequities and disparities. Communities suffering in the shadows, while some in the same region receive the best medical care in the world. As in many other parts of the country, Black and brown women bear the brunt of this unconscionable inequity. Predominantly Black neighborhoods in my district, like Dorchester and Mattapan, lead in low birth weight, preterm birth, and infant mortality. In Boston, preterm birth is 50% higher among Black women as compared to our white counterparts. Proud to be a founding member of the Congressional Black Maternal Health Caucus. I've teamed up with my colleagues to address the preventable hurt and trauma experienced by too many Black families. I want to underscore that this is a crisis, but it is preventable. Together, we drafted the Black Maternal Health Omnibus to legislatively respond to every aspect of a pregnant person's life. Everything from the impact of climate change, social determinants of health, to the necessity for improved training for the perinatal workforce is covered in the Momnibus. Especially proud that my Justice for Incarcerated Moms Act was included to address the injustices that incarcerated moms face. It's devastating to consider that I have to legislate this, but the bill would end the practice of shackling pregnant people, provide substance abuse and mental health counseling, and make other investments for those behind the wall. Many parts of the Momnibus were included in the Build Back Better Act, which is why I fought so fiercely for its passage. The Build Back Better Act have distributed unprecedented millions of dollars to community-based organizations dedicated to promoting maternal health equity, and millions more would have been devoted to expanding the maternal health care workforce, providing for the training of new midwives, doulas, and physicians. Finally, Build Back Better would have adopted a key provision of My Mommy's Act, introduced with Senator Booker, mandating that every state Medicaid plan guarantees comprehensive postpartum coverage for 1 full year. This is a common sense policy that will ensure our lowest income mothers are able to access holistic maternity care, and it will save lives. We are not going to leave this progress to chance or languishing. We will continue to advocate to get these priorities over the finish line through other avenues, given the current status of Build Back Better, knowing that the need for better Black maternal health care is an urgent one, and failure is not an option. But make no mistake, access to health care is only part of the work that remains. If we're truly going to address racial disparities in maternal health, we need to also confront racism head on. Even Black women with access to health care, with the highest levels of education, with fame and fortune, experience severe maternal morbidity. When Black women seek care, they are pushed into the cracks of a racist healthcare system that too often ignores our pain, ignores our voices, and discounts our value. Which is why, in partnership with Congresswoman Barbara Lee and Senator Warren, I introduced the Anti-Racism in Public Health Act. Our bill would create a National Center for Anti-Racism at the CDC to declare racism as the public health is. I think several of the municipalities in the Massachusetts 7th were already doing this, Boston, Cambridge, and Somerville, respectively. In addition to declaring racism as a public health crisis, our legislation, the Anti-Racism in Public Health Act, would further develop a base of knowledge to root out racism from our healthcare system. This is also why I've spent so much time in community, like we are virtually today, to ask questions about how to improve Black maternal health and to listen to learn from, and to be led by your expertise and lived experiences on these matters. This issue for me is a personal one. I never had the privilege of meeting my paternal grandmother, Grandma Carrie. I do have a picture of her on my ancestor shelf in our home library. She passed away while giving birth to my father's youngest brother. And more than 50 years later, the Black maternal mortality crisis is still robbing us of our matriarchs, stabilizing families, ravaging our communities, and causing intergenerational trauma. That is why it is so critical to create spaces like these, where we center the power and lived experience of Black mothers and work collectively to craft policies that finally advance healing, justice, and freedom once and for all. From combating the Black maternal morbidity crisis to finally enacting a national paid family leave program, to tackling the affordable child, establishing universal pre-K. These are all policies within our reach, but we must have the political courage to get them done. We have legislated hurt and harm, and now it's time to legislate equity, healing, and justice. And I know, working alongside each and every one of you, we will get there. Thank you for your commitment to healthcare justice.
Wonderful, wonderful. That was an amazing, amazing remark from our Congresswoman Ayanna Pressley. We're so thankful for her. We have another session starting in the main lobby momentarily. It will be with a yoga instructor. I'm just going to highlight some of the things I'm seeing here in the chat before we head over there. Lots of great conversation, a lot of really encouraging things around her legislation that she's been enacting, and empowerment of parents, thinking about that work, and also just this amazing opportunity to engage with the work of Congress. So thank you all so much. And it's incredible for people to be listening to these remarks here in this space with us, and also listening to Judge Jackson at the same time. What an incredible, incredible day for Black women in this country. Thank you all so much. And I'll meet you over at the main stage in the lobby for our yoga session momentarily. Thank you.